Hello, everyone. In the last lesson, we learned about general oral cleaning methods. In this lesson, we'll learn about special oral care methods. For elderly individuals with high fever, coma, or critical conditions, those on fasting, nasal feeding, oral diseases, long-term bedridden status, postoperative and elderly patients who cannot take care of themselves, as these elderly people are more prone to localized oral inflammation, ulcers, halitosis, and other complications. Special oral care should be provided according to the doctor's instructions, usually 2 to 3 times a day. If necessary, the frequency should be increased. Specific procedures are as follows. Firstly, conduct an assessment. This includes environmental assessment and geriatric assessment. Environmental assessment requires a clean and odorless environment. Geriatric assessment includes overall evaluation and local assessment. The overall assessment aims to determine if the elderly can cooperate with the procedure, such as the disease status of the elderly and their state of consciousness. Partial assessment focuses on the oral problems of the elderly, such as presence of dentures, integrity of oral mucosa, bleeding points. Second, diagnosis. After oral assessment and overall assessment, diagnose if the elderly have oral odor, infection, bad breath, etc. 3. Planning. To address the specific problems of the elderly, plan oral care for the elderly after half an hour. 4. Implementation plan. The implementation process includes preparation and manipulation. Firstly, prepare the supplies. Supplies include an oral care kit, which includes curved trays, cotton balls, tweezers, tongue depressor, padded towel, lip balm, appropriate oral care solutions. The caregiver should dress neatly and wash hands thoroughly. After the preparation of supplies, explaining and communicating with the elderly. Communicate and explain the purpose of the operation and how to cooperate. Advise the elderly to raise their hand to indicate discomfort during the procedure and avoid talking. Before the operation, the elderly should lie in a lateral or supine position. Tilt the head towards the carer's side. Place a towel under the jaw and on the chest. Place a curved tray next to the corner of the mouth. Observe the mouth first. The caregiver uses a tongue depressor in one hand to gently retract the cheek. Press down on the tongue. The other hand holds a torch and shines it into the mouth. Check for bleeding, infection, ulceration, etc. Count the number of cotton balls. Choose the appropriate oral care solution with the cotton balls and place them on the other curved tray. Manipulation. Caregiver holds a pair of forceps in each hand. Pick up the wet cotton balls. Wring dry until no water drips. Wipe in the following order. Wipe the mouth and lips first. From top to bottom when teeth are clenched. Wipe from the molars to the incisors. Wipe the proximal and lateral surfaces in the same way. Ask the elderly person to open their mouth. Clean the upper and inner surfaces of the posterior teeth. Spiral wipe the occlusal surfaces of the upper posterior teeth. Clean the occlusal surfaces of the lower posterior teeth. Spiral wipe the occlusal surfaces of the lower posterior teeth. Curve around the buccal surfaces of the posterior teeth. Clean the anterior teeth using the same method. Finish by wiping the palate. Tongue. And sublingual area. After cleaning the mouth, first dry the corners of the mouth. Then count the number of cotton balls. Make sure the number of cotton balls is correct. Apply lip balm if necessary. Finally, remove the towels. Make up the bed unit. Final evaluation. Evaluate how the elderly person feels. No discomfort. Tidy environment. Good arrangement of goods. The precautions for this procedure are as follows. 1. When cleaning the oral cavity, use 1 cotton ball for each area. Cotton balls should be wrung until no water drips and clamps securely. Prevent cotton balls from being left in the mouth, which could cause choking or aspiration. 2. Perform the procedure gently. Cotton balls should be wrapped around the tip of forceps or hemostats to avoid damage to the oral mucosa or gums. Use a mouth opener if necessary, such as elderly patients in a vegetative state or coma. That's all for this lesson. Thank you all.